Hello students, welcome to All About Nursing channel. So today's video is going to about the case presentation on heart failure. So as usual, we all know that every case presentation should be started from the patient history. So there in the beginning there should be the identification data of the patient, then the chief complaint, there is on admission complaint and at present. So at present history, so it should explain the patient's present complaint, and at present there should be medical and surgical history. Next, the past history, medical, surgical both. Then socioeconomic history, personal history, family history, that all are already discussed in previous video. So that should be completed. Next, the family genogram. Next, coming to the physical assessment. So as usual, the physical assessment should be completed from starting from the anthropometric measurement, that is height and weight, then vital signs, then patient level of consciousness, then eyes from the head to foot. Every system should be covered. So basically in heart failure you should focus on the cardiovascular system assessment, what type of findings you are getting, like the different adventitious lung sounds or heart sounds, or if there is any edema in the extremities. So in case of heart failure patient, you can see that there is pedal edema, or there is adventitious lung sound like crackles. You can get ping for the sputum if there is left-sided heart failure, left ventricular heart failure. So there is different findings you can get depending on the patient's conditions. So you have to cover all the systems. Basically you have to focus on cardiovascular system as well as our circulatory system. Okay, and you have to cover all the methods of physical assessment like inspection, palpation, percussion and auscultation. You have to cover all the system with all the methods. Okay, and if the patient is on ventilation, so if the patient has heart failure and in YHA guideline, so if the patient has in severe heart failure condition, so the patient can put into ventilation. So you have to mention the patient's mode, the in the ventilation mode, the patient's tidal volume, every parameter should be mentioned in the ventilation setup. Okay, next, coming to the investigation. So you have to explain the investigation with patient's value according to side by side. You have to give the normal value. Okay, so and you have to focus on the confirmatory diagnostic test, that is echocardiogram or cardiac markers, okay, or enzymes you have to specify. Then you have to mention the ABG analysis. Okay, so arterial blood gas monitoring, and the values of the patients, that should be mentioned. Then the medications, you have to explain the medications with the mode of action, side effects and specific nursing responsibilities. And after that, the daily intake and output, patient's intake and output should be mentioned. Then coming to the disease condition, you have to explain the heart failure. Depending on the type of heart failure, you have to explain elaborately the heart failure with the related anatomy, physiology, with the etiology according to book and according to your patient. Okay, in the pathophysiology, then you have to explain the types of heart failure, and in case of your patient, what type of heart failure your patient have. So there are different types of heart failure, you can see. Okay, classification by the NYHA, New York Heart Association, American College of Cardiology, American Heart Association categories you have to explain, and from their classifications, your patient in which classification your patient is categorized, you have to mention that one. Next, coming to the clinical manifestations. So same, according to book, according to theory and according to your patient, you what type of sign and symptoms you got, that type of that should be mentioned. Then the diagnostic investigation, the test, you have to mention same way in book, in patient. Then the management. So we all know that management comes under different classifications, that is medical, surgical, nursing. So you have to categorize that one. So medical management, that completely covers all the medicines, that is majorly the cardiac resynchronization therapy, the diuretics. Okay, there are different renin-angiotensin system inhibitor, AC inhibitors, angiotensin 2 receptor blockers, vasodilators, beta blockers. Okay, and the surgical management, there are different surgeries are there available for the heart failure, like coronary artery bypass grafting, CABG, heart transplant, VAT, LVAT, or ventricular assisted device. And there are nutritional therapies are there. So depending on the patient's condition, if the patient is able to take feed orally, so there is oral nutritional therapy is there. But if the patient is unable, patient is unconscious, patient is on ventilation, so patient should be given NG tube feeding. So that the feeding should be recommended according to the dietitian, and that should be followed. Okay. And the nursing, in the complications should be separate, same as in book inpatient, that should be written. Next, coming to the nursing management, so ineffective breathing pattern, okay, that can be the diagnosis. Next, imbalanced nutrition, decreased cardiac output, okay, excess fluid volume related to left-sided heart failure. So those are the nursing diagnosis, major diagnosis. Other than that, there are different diagnoses are there, infection, all that. Next, the day-to-day progress. So you have to mention. So minimum for the case presentation, you have to take the patient for minimum 3 days, 3 to 5 days, and you have to mention the patient's progression from day 1, the vitals, the urine output, the intake output, the creatinine burn level, so that have to be mentioned. Next, the health education or health advice depending on the diet, exercise, weight, smoking, alcohol. Okay, so that's it for the today's video.